I'm Michele Erikson, and a former executive director at Wisconsin Literacy, just recently retired in early April. And I have been a lifelong, passionate literacy advocate. And it started really back in just graduating from college, and saw a notice to be a literacy tutor. And I thought, I could do that. And so I took the training and met my student, and that was really just kind of an epiphany for me, if you will. He was a 39-year-old father of a 9-year-old boy, and he biked to the library to meet me and couldn't walk in the library because there were too many books in there, and he was totally intimidated. He said, I don't really want to go inside. He was on his bike because he had lost his driver's license, and I learned later of a letter from DMV that was 2 years old that he didn't understand, couldn't read, nor could his wife. And he was laid off and wasn't sure how he was going to find employment. And he had this 9-year-old son in third grade learning to read and really struggling. I was really taken aback by how many things in his life were impacted by a lack of literacy skills. And so we started to sit down at his kitchen table, and a letter and a word and a sentence and a paragraph at a time, and went from there. I then soon jumped on the board of directors at the State Line Literacy Council in Beloit, and was involved in that. And then a position opened up through state funding for a workforce development director, so connecting companies with literacy so that their employees would be skilled in what they needed to be skilled in. And so I took that position in 2000. And then in 2005, this position at the Wisconsin Literacy had opened up. It was just not even 2 years old. I was the only employee. There was so much potential, and with funding, looking for funding and just building the capacity of our programs to do this, we started with regional staff.
Image of Michele with 7 staff members at the 2016 Celebration of Literacy event.
The staff at Wisconsin Literacy and the board of directors that we've had over the years have been just instrumental among the local programs that we are supporting. So just the number of local member agencies that have been a part of Wisconsin Literacy, and the way in which our work is impacting them. So the resources we provide, the funding we provide, the professional development and the training that we provide to these local agencies so they can reach more adults more effectively and efficiently. That growth and commitment to those members is something I'm really, really proud of.
Michele and 2 others in bright green t-shirts. They are holding an oversized check from the Big Share.
The second thing I think I am most proud of with my time at Wisconsin Literacy is the development and growth of our health literacy division. So Wisconsin Health Literacy was launched officially maybe in 2010, about 5 years after I had started, and we had worked previously to that to build understanding of health access, health understanding among our literacy agency students, and learned a lot. And in doing so, we also realized that the other side of that coin is helping healthcare providers actually communicate health information in ways that are more accessible for everybody. One of the projects I'm most proud of is a 10-year medication label initiative where we worked with pharmacies across the state and then healthcare systems to change the way prescription medication labels read so that they were easier for everybody to read and understand and take their medications appropriately. And so that was a big systems change. Over 21% of the pharmacies in Wisconsin became part of the project and changed their labels. But then we worked on the dosage instructions with another phase of the project. And right now in the United States, 3.5 to 4 million prescriptions go out every month with this new easy-to-read dosage instructions, compared to just 78,000 just less than 3 years ago in 2021.
Michele at Wisconsin Literacy's biannual National Health Literacy Summit in conversation with a participant of the summit.
It's not just adults that have limited literacy skills that are challenged with our healthcare system. So if you have an aging adult parent or, all of us have healthcare or health literacy stories where we have gone into that system and been challenged in one way or the other. Wisconsin Literacy is a registered lobbyist organization, and I was a registered lobbyist in my time there.
Image of Michele speaking at a podium that reads Monona Terrace.
And it took me a long time, I think, to feel comfortable with that and to be effective at that part of the role. We have been a really good partner to get services to the local level, where sometimes state agencies, as their size and the way in which they work, don't have quite the same access to the community. And so the advocacy work, I think really over the long run has really paid off, because I think now legislators...
Michele posing and smiling with Governor Tony Evers.
The governor's office have recognized the power of kind of this community impact that nonprofit organizations can really have at a local level. We all have the power to impact change or to make change. And in terms of literacy, seeing an adult volunteer tutor with an adult student and the information, the self-confidence, the power, the literacy skills that are being shared in that engagement is so rewarding to see that literally, that lives are being changed, and it's not just the life of the student.